Hello, my name is Grant Steger, and I'm doing mine on congestive heart failure. So, what is congestive heart failure? Well, it ties in with coronary heart disease. Coronary heart disease slash congestive heart failure usually results in a malfunction of the aortic valve and a few other malformities of the heart. Usually, there's a buildup of plaque within your valves that makes it so it doesn't work properly, leading to poor drainage, poor diffusion of blood into the tissues and oxygen, and it reduces your ejection fraction, which basically means the heart's trying to pump, and it's not pumping as much blood out as it should. All right. Coronary heart disease has many precursors, such as low ejection fraction, which I just talked about, and a large left ventricle, which is like right about here. That is the main pumper for the body. Due to its size, it makes it gets thicker, and it tries to work harder to pump as much blood through as it normally would. And with that working harder, it means the rest of the heart's gonna have to work harder. Let's see. Also could lead to poor conduction of the heart that can cause damage and poor blood circulation to the cardiac tissues itself, which will cause the disease. So with the conduction, you have your SA node, AV node, you have your bundle branches, which are all conductive. You could call them nerves, which basically are an impulse that work by themselves it's basically your pacemaker. Gives a little electric shocks to get the heart going, like boom, 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 boom. You usually see these in EKG, all the conduction of the different valves and stuff. Let's see, what common issues that someone would face with coronary heart disease would be dyspnea, shortness of breath. Let's say you're exercising and your heart is trying to do what it can to pump enough blood, oxygenated blood throughout the body, but it just can't because of, let's just say, conduction issues. There's something wrong with your valves. Um, you have a low ejection fraction. You're gonna feel short of breath. Like you're breathing as hard as you can, but it just doesn't seem to be working while you're exercising. Let's see. You can experience this while sitting. With a shortness of breath, that means you're really not in a good spot, and your heart rate will be elevated while performing moderate exercise. So when I say elevated, say you're going for a walk. Uh, uh, Actually, let's start with sitting. Sitting down, your heart rate should probably be around like about 80 beats per minute. Say you're up and walking around, maybe you get up to like 100, 115. For an elevated one, you'd probably be around like 130. That would not be pretty good if you're just like walking around doing daily activities. And on top of all this, uh, build up a plaque of from HDLs and LDLs will basically constrict your blood vessels so that the heart will actually have to work harder for that too. It could build up in your heart, could build up in your arteries and veins. Basically, a recipe for potential disaster. And there are different classifications for this. There's ischemia, which can result from smoking or nicotine products, which basically toughens the heart muscle, makes it so it's not as pliable, like or slash elastic. Think of like a rubber band, how it's able to move nice and easy. And then you just, I don't know, leave it in the sun for a while or get it real cold. Try and stretch it again. Snaps. It's way less elastic. See, congestive angina. Oh, chronic angina. That would be heart pain right there. You're working hard, feeling a little bit of chest pain. Then, of course, there's acute chest pain, say you're like running real hard and all of a sudden you have to stop because you just feel all that pain, don't want to do anything, hurts. And there's a STEMI, which is ST elevation. So with your EKG slides, you or panels, first starts with P wave, then you have QRS complex, then it goes to ST segment, which is uh, right after your ventricles pump, and it's that refilling process. There's isoelectric line on your EKG, and if that's elevated, that means it's basically working harder to get that job done. And there's non-STEMI, which there is no ST elevation, but your troponin levels are increased. And unstable angina or unstable chest pain just kind of happens, which is really annoying, confusing. Let's see what we got next. Well, talked about all that, kind of some precursors, like what it was, but now we could talk about your diet. Foods to eat more often would be 6 servings of whole grain bread or cereals, 3 to 5 servings of fresh, frozen, or canned vegetables without the fat or salty sauce, 2 to 4 servings of fresh canned or dried fruit, 2 to 3 servings of low or fat-free dairy products. So fat is really your biggest concern with your diet, making sure you're not getting in unsaturated, wait, no, saturated oils. Think of like something that congeals on its own at like room temperature, something like butter or like bacon fat. Want to stick away from those because it will do that in your blood vessels. And I was talking about earlier how that buildup of plaque can increase the amount of pressure within the valves, making your heart have to work harder. If you already have like chest pain or shortness of breath, it's already not a good sign. Let's see. This also comes with lean meats. Want to eat lean meats. Fish is okay, but probably want to stay away from like burgers or something. Probably want to eat stuff like pork chops that are pretty lean. What basically meats with low fat. And then habits for prevention and treatment. Reduce your time being sedentary. ACSM recommends 150 minutes of moderate exercise and at least 2 strength training sessions or vigorous exercise per week. When I say moderate exercise, like you don't have to like go for a jog for 30 minutes for 30 minutes 5 days a week, but it is a good way. Moderate exercise could just be you walking around your house doing chores or I don't know, walking the dog or whatever you like to do. See, I've recently started playing pickleball, which is pretty fun. That counts as moderate exercise. And I strength train, so that gets those done. Develop healthy eating patterns. This can be different for everybody, but most people just eat like 3 to 4 meals a day. I normally eat like two bigger ones. I just try and get a good amount of macros and vitamins and nutrients. Let's see, another habit. If you're smoking, stop smoking. And if you're not, just don't smoke or stay away from nicotine products like chew, vaping. This will reduce the effects of your ischemia buildup. Remember talking about that elasticity of that pericardium, which is a sac around your heart, which holds all the blood that oxygenizes your cardiac tissue, and ischemia affects the elasticity of your cardiac tissue. Then alcohol consumption, just if you're drinking a lot, just reduce that down. That should help with a lot more than just this. And here are my sources. I used our book, the Vital Source Online, and I also went to National Library of Medicine and found some pretty good stuff there. So yeah, that's about it.